that is as calm and as pain-free as possible is the ideal. But today, Channel 4 News has learned that doctors are struggling to prescribe drugs like morphine for patients, including those with COVID-19, because of laws that restrict their use.
When you prescribe a controlled drug for a patient, it has to be for a named patient, and it can only be used by that named patient. And also that hospital pharmacies cannot dispense drugs to some patients living out in community settings. So those are the two regulations. They both have a reasonable rationale during normal circumstances. But in this time of crisis, what we're seeing is for some patients who require these drugs, it's really difficult to get hold of them quickly. And yet in the same home, maybe even in an adjacent bed, there might be a patient with a pile of those drugs that we could use, but legally we're not allowed to at the moment.
And these delays, because the patient has to be named on the prescription, are made even worse, as those with COVID can deteriorate quickly. In a strongly worded letter to the Home Secretary, Priti Patel, which we have seen, the Royal College of GPs urges a temporary easing of restrictions around controlled and other required end-of-life drugs in the light of the current COVID-19 epidemic. And they say, we are aware of incidences where this has caused significant and unnecessary distress and pain to patients and their families at the end of their lives.
We want to be able to have something that very quickly gives people the pain control and breathlessness control that they need. So reducing the wastage and not having to send that back to the pharmacy to potentially be destroyed is incredibly important.
And while there has been much focus on ventilators, the shortage of kidney machines revealed on Channel 4 News last week is now becoming acute, along with the fluids and the tubing needed to run them. Up to 1 in 5 in critical care need some form of dialysis. Now the Department of Health has issued an alert saying there are limited supplies and that they should be conserved. Part of this is about dealing with a virus that had never been seen, where there is more that is unknown than known. This problem has even led to disagreements over that most basic pieces of equipment, the face mask. The World Health Organization still says there is little evidence they offer protection, and today SAGE, the scientific committee which advises the government, has been assessing this. One of the possibilities they're looking at is that they recommend for people who can't stay more than 2 meters apart because they've got to go into shops or into work or onto public transport, is that they use face coverings. Now that's the critical issue, not face masks, face coverings, because what they do not want is to deplete the stock of those masks that are needed for frontline healthcare workers. A move certainly supported by this academic.
There is absolutely no need for the lay public to be wearing medical grade masks. They're horrible and scratchy and you know, they don't feel good. What we should be wearing is a cotton covering, which you can make out of an old t-shirt, fold over 2 layers of cotton, and that will stop the droplets coming out of your mouth and nose and turning into those very dangerous viral-laden aerosols.
She said that evidence shows this would block 95% of the droplets, having a significant impact on the pandemic. But what is also needed to help bring this to an end, advisors say, is a vaccine. And today in Oxford, they began the first patient trials.
It seems like the right thing to do to ensure that we can combat this disease and get over it a lot faster.
Hopefully this will give us some good data, and then hopefully in a couple of months or maybe a year or so we'll be able to protect more people with this.
This has happened in record time, although we are still a long way away from knowing whether it is effective and that it will save us from the virus.